allergy and fever. And as you all know, there are 4 or 5 common allergic disorders in children. The commonest being asthma. Then we have the allergic rhinitis, then atopic dermatitis, urticaria, angioedema, and food allergy. These are the common allergic disorders that we see. But our topic is on allergy and fever. And according to the American College of Allergy and Applied Immunology, they say that allergies don't cause fever. Allergies don't cause fever. And associated complications of allergic disorders, like other infections, can produce fever. For example, in a child with an allergic rhinitis, they can have associated sinusitis, and this can present with fever. So allergies per se, fever is not a usual manifestation of allergic disease. Okay, then coming to the asthma and fever, I know asthma is a common clinical diagnosis. A child presenting with more than 3 episodes of wheezing per year, and if the wheezing is reversed with a bronchodilator, you can make a clinical diagnosis of asthma in children about 5 years. But in those children less than 5 years, it is called an under 5 wheezes. Under 5 wheezes comes under 2 groups, depending on the symptoms. It can be an episodic viral wheeze, or it can be a multi-trigger wheeze. Episodic viral wheeze, as name suggests, is associated with fever. Any child less than 5 years presenting with recurrent episodes of fever without a family history of asthma or atopy, it is called under 5 wheezer, and these children are asymptomatic in between the episodes. And the child is asymptomatic in between the episodes. And the commonest viruses that produce episodic viral wheeze are, one is rhinovirus, Broca virus, human metapneumovirus, influenza virus, and parainfluenza virus can produce fever. But it is associated infection that can produce fever, and not asthma itself can produce fever. So how will you manage these children? You can manage these children. The main thing is that you give an nebulized salbutamol for acute management and long-term management, depending on the severity of the disease. If a child is having a very severe disease, then very frequent attacks of wheezing, more than 3 episodes per year, these children can be given a long-term prophylactic drug, either montelukast or inhaled corticosteroids. You can have a trial with inhaled corticosteroid, budesonide up to 400 micrograms per day, and it can be given for a period of 6 weeks, and you can see the response. The second condition is allergic rhinitis. Coming to allergic rhinitis is a very common disease that we see in children, and our own study from Kottayam district shows that more than 40% of children has got allergic rhinitis, and allergic rhinitis as such will not produce fever, but the complication of allergic rhinitis, like allergic sinusitis, can present with fever. Even though it is called hay fever, fever is not seen in these children. Coming to allergic rhinitis, these children will have mainly 4 symptoms. A child presenting with sneezing, nasal block, nasal itching, and nasal discharge. Among these four symptoms, if more than 2 symptoms are present for more than 2 hours per day for a period of 2 weeks, you can make a diagnosis of allergic rhinitis. Now, this is the classification of allergic rhinitis. ARIA classification depends on the duration of illness. Duration of illness can be intermittent allergic rhinitis or persistent. And depending on severity, it can be mild, moderate to severe. So a child can have mild intermittent allergic rhinitis, mild persistent allergic rhinitis, or a child can have intermittent mild allergic rhinitis, persistent moderate severe allergic rhinitis. But fever is not common. But these children can develop sinusitis. We can also present with fever. These are the common symptoms of allergic rhinitis: running nose, sneezing, lacrimation, headache, rash, cough, and periorbital edema can be there. And what is the management? Just like GINA guidelines for asthma, there's ARIA guidelines is there. There's a step-up management of allergic rhinitis is there. You can start with the 2nd generation antihistamines, or you can try intranasal steroids, and lastly, immunotherapy. Coming to the third problem, atopic eczema. Again, I want to highlight that fever is not a common presentation of atopic eczema. These children will present with the rash mainly on the face by second month of life. And as the child goes, they will develop flexural dermatitis. But this atopic dermatitis can get infected with organisms like staphylococci. Then these children will present with fever. So the treatment is you can have an moisturizing skin moisturizers. Then you can have steroid ointment. And if you suspect a staphylococcal infection, you can have anti-staphylococcal dust can be given. Coming to the fourth problem, food allergy and fever. Food allergy usually will not produce fever. The main symptoms of food allergy include wheezing, skin infections like hives, swelling and itching, watery and itching eyes, running nose, burning sensations in the lips and mouth, and they can rarely present with anaphylaxis. The common trigger factors include milk, nuts, eggs, wheat, fish, and shrimp, crabs, etc. But even though this child can present with allergic manifestation, fever is not commonly seen in these children. Coming to other skin manifestation of allergy, these children have urticaria or angioedema. In children with urticaria, when they are presenting with an acute episode, they can have fever, and as the rash disappears, the fever also subsides. And the treatment is mainly a second generation antihistamines and a short course of steroid can be given. So to conclude this talk, what I want to highlight is that allergies usually will not produce fever. Only complications of allergy like allergic rhinitis present with sinusitis or a skin infection associated with atopic dermatitis can produce fever.